In the intricate command center of the brain, billions of neurons communicate in perfect timing. But sometimes, a small change deep within our DNA sets off a chain reaction that will one day disrupt that harmony, an uninvited storm that slowly takes control. Huntington's disease begins with a change in a single gene, the HTT gene. This gene carries instructions for making a protein called Huntington, crucial for healthy nerve cells. But in this condition, a segment of the gene, known as the CAG repeat, expands far beyond its normal limit. The result? A toxic form of the Huntington protein that builds up inside brain cells, slowly damaging and killing them, especially in regions that control movement, thinking, and behavior. The effects start subtly, almost invisibly. In the early stage, movements become less precise, small twitches or fidgeting may appear, thinking feels slower, concentrating becomes harder. Emotional balance begins to shift, sometimes toward irritability, anxiety, or depression. As the disease progresses, the signs become harder to ignore. Involuntary jerking and writhing movements, known as chorea, trouble with coordination and balance, slurred or slowed speech, difficulty swallowing, making eating a challenge, memory lapses, and poor judgment, changes in mood and personality from sudden outbursts to deep apathy. Eventually, even the simplest tasks, like walking or speaking, require assistance. There is no cure yet, but science has developed ways to manage its symptoms and slow its impact on daily life. Certain medications can ease the storm inside the brain. Tetrabenazine and deutetrabenazine help reduce chorea by controlling the levels of dopamine. Antipsychotic drugs like haloperidol or olanzapine can calm severe movements and stabilize mood. Antidepressants such as sertraline or fluoxetine help lift the emotional burden. Mood stabilizers like valproic acid can balance extreme emotional shifts. Beyond medication, a network of therapies supports the mind and body. Physical therapy keeps muscles active and movements more controlled. Speech therapy preserves communication for as long as possible. Occupational therapy helps adapt the home and routines, protecting independence. Nutrition support ensures strength, even when swallowing becomes difficult. Huntington's disease is written in the language of our DNA, passed silently from generation to generation. But within the labs and clinics, researchers are working to change that story, developing treatments that may one day stop the damage before it begins. Until then, each step forward is about care, dignity, and living every moment with strength.